Respiratory illnesses are spiking across the United States and Virginia. As we kick off the first day of National Influenza Vaccination Week, medical experts at the Centers for Disease Control warn COVID and flu cases are rising and vaccination levels are dropping. And doctors tell me those aren't the only respiratory illnesses floating around this year.
It is going to be a confusing respiratory infection season. Figuring out what's making people sick is going to be a conundrum.
Hospitals and urgent care centers across the country are grappling with rising cases of respiratory infections.
The flu season really started out strong.
Dr. Brooke Rosheim of the Virginia Department of Health says more than 9% of visits to emergency departments and urgent care centers are for flu-like symptoms.
Far higher in terms of the amount of flu activity that's estimated to be out there, really than the last really 5 to 6 seasons.
Doctors with the Centers for Disease Control say healthcare workers are seeing everything from RSV to the flu to COVID-19 infections.
The people that are testing negative for flu, COVID, and RSV should be very glad, but understand those aren't the only respiratory infections that are out there.
American Medical Association Board Chair Dr. Sandra Freihofer and CDC Director Dr. Rochelle Walensky said while standard advice like staying home when sick and washing your hands will help slow the spread of infections, some illnesses are preventable.
There are other pathogens out there. We want to make sure that we are on top of the ones that people can do something about.
Dr. Walensky said her team is seeing lower rates of vaccination compared to this time last year, and she's warning Americans, although you may have received both doses of Moderna or Pfizer vaccines, you still need the new updated bivalent COVID vaccine targeting the Omicron variants.
We know that if you've received your primary series only, your primary COVID vaccine series only, you are considered fully vaccinated, but you are not considered fully protected.
Although some have voiced fears over a triple-demic, and that's rising cases of flu, COVID, and RSV at the same time. Health experts say they're seeing signs RSV cases have peaked and are now dropping in many areas, including ours. I'll have a look at the latest data on that coming up on 13 News Now at 6.